Africa faces challenges in the health sector that threaten the quality of life of its citizens and overall economic growth. The cost of private health care is rapidly rising, along with the basic costs of living. The Discovery Foundation says the National Health Insurance can address this and be used to create a credible public health sector. The Discovery Foundation says the NHI will be the first step for all South Africans to quality health care. Currently, only 17% of South Africans have access to private health care. The foundation has welcomed a probe into the cost of private health care. It says it will reveal the reasons behind the cost drivers and the need for them. The foundation's managing director, Dr. Ayanda Natsaluba, says the inquiry will also probably help tighten the regulatory framework. Well, solutions to healthcare challenges in the modern world. Now, this was the theme of that Discovery panel discussion earlier in the day. And Discovery Foundation Chairman, Dr. Vincent Mapai, was on that panel. He joins me now. Dr. Mapai, thanks for coming in.
Thanks, Kevin.
Well, I hope fruitful discussions this morning. Perhaps I should start with a broad question, because many people don't feel this. Do you think that all stakeholders involved in healthcare are making equal efforts to make affordability a better thing in South Africa in terms of healthcare?
I don't think so. I think if you look at the effort, collective effort we made, for example, in the fight against HIV/AIDS, the strides were tremendous precisely because all stakeholders were pulling together in the same direction instead of bickering. I think in this area there's still a common consensus to be reached, but I do feel slowly, with small steps, there is a move towards consensus amongst the stakeholders, tortuous at the moment, but I think we are getting there, but we are not there, and we should not fool ourselves.
Okay, I mean, the question is why, and part of that is this Competition Commission inquiry into healthcare and the regulations involved. Now, if you watch the Treasury, it said last week that it's not going to wait for this Competition Commission inquiry to resolve itself. It will try and implement some of those policies by at least November. The industry is calling for a delay. What's your take on that situation?
My view on the bulk of public policy is that sometimes it is better to be late by a few months than to bully recalcitrant people or people who appear to be recalcitrant, because what you then have, you create a situation where partners, instead of throwing a full weight behind you, they actually begin to devise means of how to undermine you. It's still our view that perhaps we should have taken a bit longer, understanding each other, engaged here where the issues are, because the issues are not simple.
If you look at some of the companies involved in selling some of these healthcare products, I mean, there's a big concern that they could close down if those regulations go ahead. Is it as bad as that?
Well, some of them definitely could. And we are not suggesting that there are no issues to be addressed. You know, there are issues to be addressed. Make sure that the correlation be, you know, the whole insurance industry is probably regulated, and at the moment there's a whole lot of ambiguity. So we do believe that that needs to be tidied. And we would have preferred that it is tidied once and for all and phased in. I think every new change you make, rather face it in, you know, and make sure that you do not create a medicine which is worse than the disease.
Yeah. You look at the younger individual in terms of these insurance products, when they tend to opt out of medical aid schemes, it threatens the sustainability of it, doesn't it? How big of a problem is this?
I don't think it necessarily threatens them to a point of closure. And our view is regulate it in such a way that we know who can and who cannot play in that space. And I think that is what we think needs to be tidied, rather than just a sledgehammer approach. There is a cleanup, as I said, that needs to be done. But I don't think it is at the point where I can only speak for Discovery, where Discovery runs the risk of shutting down tomorrow as a result of this. No.
Yeah, we started off by saying, and this is my final question, about the national health insurance and the fact that it holds the key for giving health benefits or access to health care to broadly the South Africa's population. Is the momentum, though, of achieving the implementation of this too slow?
It is. It could be. It could move much faster. And I go back to the point you made. Only 17% of the country or so, around about that, has access to private health, which means there's no way the private health can deal with the remaining 83% or so. You need a much more decisive intervention on the public sector. And that is why we think the NHA is important and critical, both in terms of equity in the health system, the costs and everything. So we think we need to really jack up and move out much quicker than we are doing now.
And that's where I'm going to have to leave you. Dr. Vincent Mapai, the Discovery Foundation Chairman, thanks very much indeed for talking to us.
Thanks very much. Thank you.